Heavy snoring can be far more than a nuisance. It can be a sign of obstructive sleep apnea and possibly heart disease. So wake up to the possible health risks that heavy snoring may signal.
When we think of coronary risk factors, the factors that are associated with cardiovascular disease, we all think of smoking, diabetes, high blood pressure, family history, high cholesterol. But there are other risk factors that relate to cardiovascular disease, and obstructive sleep apnea or sleep disordered breathing is one that we're getting more and more interested in. The most important sleep disordered breathing related to cardiovascular health is called obstructive sleep apnea. This is the characteristic pattern of people who snore at night or very often overweight. The physical problem is actually a blockage in the back of the throat that causes the snoring. When the person obstructs at night, they usually stop breathing, and when you stop breathing, the oxygen level drops dramatically in the blood. At that point in time, there's a surge of adrenaline, and there's a surge of steroid hormones. The brain triggers a response from the adrenal gland, which is where these hormones come from, and those hormones then contribute to high blood pressure, irregularities of the heart. Those hormones are what triggers heart attacks or can trigger heart attacks. Heart failure can be one of the causes of obstructive sleep apnea, and obstructive sleep apnea can seriously worsen heart function and aggravate heart failure. What we do know is if you treat people with obstructive sleep apnea, the risk factors of cardiovascular disease improve dramatically. The most important step for treatment is recognition and appropriate diagnosis. What we'll tell some people to do is just simply sleep on your side. Find a way to stay off your back. They can buy pillows that allow them to turn themselves, and that relieves it in a significant number of people. If they're significantly overweight and have all the characteristics of sleep disordered breathing, particularly daytime fatigue, drowsiness, we send all those patients to a sleep clinic for appropriate testing and therapy. If you treat the obstructive sleep apnea, cardiac function actually improves. The pumping function of the heart can improve. Hypertension can improve. Arrhythmias or atrial fibrillation and these extra heartbeats, triggering of defibrillators. All of those things can improve with appropriate treatment.